Hey, welcome to the explainer. Sometimes a patient comes in with a complaint that sounds kind of simple on the surface, but it's actually really distressing for them. I'm talking about persistent hiccups. So today we're going to build a practical playbook for you, the pharmacist, so you can handle this tricky situation like a pro.
All right, here's the game plan. First, we'll get into just how serious this complaint can be. Then, we'll talk about digging for the root cause. After that, it's all about the options. Non-drug stuff first, then prescription therapies. And finally, we'll wrap up with the nitty-gritty on dosing and how long treatment should last. Let's get to it. So, let's set the scene. Imagine a patient walks up to your counter, they look totally wiped out, super frustrated, and they tell you, "I've had hiccups for 3 days straight." What do you even say to that? I mean, this is one of those moments where just saying, "try holding your breath," is not going to cut it. This is where you, the pharmacist, can really be a hero. Okay, first up, a patient's distressing complaint. And believe me, it's way more than just an annoyance. For the person going through it, we're talking about serious stuff, like not being able to sleep, losing weight, even getting depressed. So that first step of just acknowledging how awful this is for them, that's huge. It's how you start building that trust. All right, on to our next play, investigating the underlying cause. This is all about what you can advise the patient to bring up with their doctor. Because let's be real, hiccups that last for days are almost always a sign that something else is going on. Our job is to help them get ready for that important conversation. Okay, so this is super important. There's actually a clinical difference here that changes everything. We have persistent hiccups, which is what our patient has, anything lasting from 2 days up to a month. But if it goes on for more than a month, now we're in intractable territory. And that distinction, just how long it's been going on, is the key that unlocks the whole diagnostic and treatment plan. So what exactly should they be ready for when they see their doctor? You can give them a heads up that the doctor's going to dig deep. They'll probably ask about their entire medication and alcohol history, and they'll be looking for red flags, potential underlying causes, stuff like GI issues, problems with the central nervous system, or even irritation of the big nerves like the vagus or phrenic nerve. And this is where we, as pharmacists, can really jump in. A solid medication review is an absolute must. Now, drug-induced hiccups aren't super common, but when they do happen, these three tend to be the usual suspects: alcohol, corticosteroids, especially dexamethasone, and benzodiazepines. A quick scan of the patient's profile for these is a super important first step. Okay, moving on, let's talk about counseling on non-drug options. A big part of this conversation is going to be about managing the patient's expectations on what actually works versus what's just, an old wives' tale. So, here's a really crucial point. We all know the classic cures, right? Holding your breath, getting scared, drinking water upside down. And while that stuff might work for a quick bout of hiccups, you need to gently explain to the patient that for persistent cases, there's just no evidence they do anything. Being upfront about this can save them a ton of frustration. But you can let them know that there are other, more serious interventions their doctor might look into if nothing else works. We're talking about things like gastric aspiration if their stomach is distended, all the way to things like nerve blocks or even nerve disruption as a total last resort. The point is to show them that there is a plan B and a plan C if needed. There's an escalation pathway. All right, now we're getting to the heart of our playbook: navigating prescription therapies. This is it. This is what you need to know when that RX comes across the counter. Time to shine. Okay, first things first, and this is a big one. The evidence for these treatments is, well, it's pretty limited. We don't have a go-to gold standard drug here. Most of what we're working with comes from small studies and case reports. And that's really important to know because it explains why a patient might have to try a few different things before they find something that finally works. So let's break down the most common meds you'll see. Think of this as your cheat sheet. For metoclopramide, you're going to want to talk about sedation and the potential for extrapyramidal effects. With baclofen, the big ones are adjusting the dose for kidney problems and, super important, telling them not to stop taking it suddenly. And if you see a script for chlorpromazine, you'll need to cover sedation, the chance of low blood pressure, and making sure they stay out of the sun. Now, here is a massive, bright red flag. Avoid benzodiazepines. I know, it seems kind of counterintuitive, right? They're CNS depressants. But there are reports that they can actually make hiccups worse. This is one of those pieces of info you absolutely have to have in your back pocket. All right, last section, the dosing and duration talk. This is where we guide the patient through the actual treatment process. It's all about setting clear expectations for the road ahead.
So you can break down the whole process for them into 3 simple steps. Step 1 is the trial period. They'll just use the drug for a day or 3 to see if it even works. If it does, great. That's step 2. Their doctor will start to slowly taper the dose down to find the absolute lowest amount they need. And step 3? Well, if the hiccups come back during that taper, they just find that lowest dose that keeps them away and stick with that for maintenance. Easy.
And if there's one number you and your patient should remember from all of this, it's 3. 3 days. If a drug is doing absolutely nothing after 3 days, there is no point in continuing. This is so empowering for the patient because it gives them permission to call their doctor and say, hey, this isn't working, what's next?
So, to put a bow on all of this, let's recap the key takeaways from our playbook. First, know the difference between persistent and intractable. Second, always advise them to get a full medical workup to find the real cause. Third, be honest about the limited evidence for a lot of these treatments. And finally, nail the counseling on side effects and those all-important tapering schedules. You do those 4 things, you've just delivered an amazing consultation. And that brings us to the final question. How can you turn this rare, kind of weird complaint into a truly memorable counseling success? Well, look, persistent hiccups might not be something you see every day, but with this playbook in your pocket, you can take what is a really distressing moment for a patient and turn it into a moment of clarity, support, and success. A moment that really shows off just how valuable your clinical expertise is.